And you see these little bizarre beats right here, right there. Those are abnormal beats. We call them PVCs. There's a PVC there, and so on. So this is during the resting stage, and this is abnormal. So the question is, why is she having this? Welcome back to Montgomery Heart Wellness, and we have another MHW clinical rounds. Guys, who's up today?
I have a female LN. She's a 65-year-old female who came to our clinic for the first time. When she came to our clinic, which she was told from the month before she had been hospitalized for elevated blood pressure and pneumonia, that she was in heart failure during her visit there. They expressed to her that her ejection fraction was about 30%. So she came into the clinic wanting to speak with you to figure out how can she approach this to correct the situation, her new diagnoses. During the clinical presentation, she mentioned having periodic palpitations, but she never really complained of having any shortness of breath or having any difficulty breathing or anything like chest pain. When I first assessed her, I talked to her about, she said she had hypertension for about 5 years, but that was the only pertinent medical history that I had from her. When I kind of explored the other things, there was no sleep issue, she was not exercising at the time, and she was basically eating the standard American diet. So when we first kind of looked at everything, first set of vitals showed that,
So no history of a heart attack?
None.
Or anything? She ever told she had an abnormal EKG or
No.
anything?
She never expressed any of those things before. That she mentioned no one's ever talked to her about these things. So it was completely out of left field when she was diagnosed with this.
So other than high blood pressure, she didn't know about any medical problem like high cholesterol or diabetes?
Nothing. After she told me at the first visit.
Camille, what are your thoughts? I mean, so this lady comes in, she's 65 years old, and when somebody has ejection fraction 30%, that's pretty low. What are the things we think about in terms of cause of heart failure that the audience should think about?
I think one of the most common things we first think of is, do they have significant coronary artery disease, stenosis or blockage in the arteries of the heart? Chronic untreated hypertension can go undiagnosed, especially in people who don't go to the doctor regularly, and that can make the heart weaker. Those are some of the things more commonly we think about, and so I feel like a lot of times people have more health issues than they're aware of.
I really want to emphasize to the audience, because I know there are a lot of people there, and those of you who haven't heard, we have a docu-series, Heart and Soul of a Champion, where we talk about the health of individuals, and we go more in depth into their lives and their stories. And the reason I mention that is our season 1, which is out now, we have individuals who come in, and some of them are very healthy, and one man is very athletic actually, and we found that he had coronary disease. And so the reason I mention that is because even though she didn't have any symptoms or present to her emergency room, people can have what's called ischemia, which is abnormal blood flow, and it can be silent, so you don't have symptoms of chest circumference, or you have what's called a silent heart attack or silent MI.
Her follow-up findings, it was very surprising. We actually found that her ejection fraction was 55-60%. So completely different from what we originally thought when she first came in to talk to us about.
Interesting.
Yeah, and that's
how do you explain that?
Well, I mean, then you kind of look like it might just have been an acute event that was occurring when they were in the hospital, because she did tell us that she had issues with pneumonia at the time.
Yep.
So it might have been an inflammatory issue at the moment that occurred, that presented itself in that manner. We did find also she had some degree of diastolic dysfunction, which is basically when the heart impaired relaxation after the contraction, which would be something we commonly expect with someone who has a prolonged history of hypertension as well. So we kind of expect to find that. She did show a left ventricular hypertrophy, which means the left ventricle is a bit enlarged. Again, kind of correlates with the idea, prolonged hypertensive problem. She had mild regurgitation from the tricuspid as well as the mitral. But none of it really kind of fit the whole diagnosis of her having an ejection fraction at 30%.
Yeah.
So we're kind of questioning it, like, well, what happened there? We even looked at her right ventricular systolic pressure, which is also normal.
Yep.
So overall, the functionality of the heart didn't present of her coming in when she first told that she had heart failure.
Yep.
So that was very surprising.
One, let's say the first reading was correct. It was an ejection fraction of 30%. Like you said, she was acutely ill, and there was lots of inflammation. And, these ejection fraction, and for those of you who haven't seen other shows, ejection fraction is a percentage of blood that the heart squeezes out with each beat. So, if the ejection fraction is 25%, it's each beat it squeezes out 25% of the blood. Normal should be at least 50, but like a little bit above 50. This case, only 30%. So that's a very significantly compromised left ventricle. So her acute illness may have caused some stunning or weakening of the heart. We do know also individuals in the throes of a heart attack, or they may have acute, what we call ischemia, or poor blood flow to the heart will be stunned. So it'll be weakened temporarily. And when things calm down, when they're over the event, like she may have had a pneumonia or whatever, when all of that is cleared up, then the heart can recover and beat normally. So that's certainly a possibility, and it could have been the case here. The other possibility is that because she was acutely ill, she has a BMI of 42. So, body habitus may be such that they didn't get a good reading at the time. And so now that she's more calm, we got a better reading. So all those things are possible, but clearly she have now what we call diastolic heart failure. Now, we don't frequently use the term heart failure when you talk about diastolic dysfunction, but that is a form of heart failure. So even though her heart is not weak, but it's stiff. And so the amount of relaxation is important too. So she have impaired relaxation and the heart's a little bit thick. Is that a surprising finding in somebody with high blood pressure or obesity?
No, that's extremely common.
But as you mentioned, the right-sided pressure not high. And then so we did a stress test, and what did that show?
It showed there was no significant ischemia. So then we don't think there's a lot of issue of mismatch occurring with perfusion for the heart. So kind of going back again, we tend to think that sometimes people who have a low ejection fraction, there might have been a traumatic event to the heart muscle that weakened the heart at some point, and it doesn't kind of show up on the stress test that she didn't even have any issue perfusion problem.
So, but on the exercise, on the stress test, and I made a note here, we reviewed it. Her blood pressure started out sort of in the borderline normal range, at least diastolic was normal, 135/64, heart rate 56. But then with just less than 5 minutes of exercise, it went up to 180/99, and the heart rate 158. That's pretty a drastic change. And what was she on medication-wise?
Medication at the time when she came in, she was on the regimen which was prescribed for her because of her heart failure. She was on a medication called Entresto. She was on a low dose of Entresto. She was on the metoprolol 25 milligrams and furosemide 20 milligrams. And so again, these are definitely the common medication we do see for heart failure.
Yeah.
And so that definitely could have been contributing to what maybe she was very dehydrated, which originally the thought process was. Because when we first looked at varied labs, when we were looking at her values as kind of an evaluation, and it was noted that her BUN level, which is your bilirubin, urea, and nitrogen level, and your creatinine was elevated. So we definitely saw that there was a regression of her kidney function during her very first visit. So when we were thinking originally, our first thought process was that even though her ejection fraction was normal, that maybe she was volume depleted, and so that was putting stress on her kidney function. And that could be the response of what you saw during her stress test, because she was so volume depleted at the time. So the thought process here is maybe to try to back her up of the diuretics to see how she would turn out from there and see if we can improve her renal function, originally the thought process.
So somebody with a stiff left ventricle and thick like hers, you can just imagine a very small chamber that is hard to fill, so you need extra filling volume and pressure to fill that heart up to let it squeeze. So if you give them a diuretic and dehydrate them, it may make that condition worse. And we can see here when she started exercising, the heart rate went up really fast. Again, the heart compensates. Let's say, for instance, your house has got water up in your kitchen or something, like 4 feet of water, and you have the option to use a 5-gallon bucket or a 1-quart bucket, and you got to empty that water out, and you got 1 hour to empty that water out. Well, if you got a 5-gallon bucket, versus a 1-quart bucket, that 1-quart bucket, you got to scoop it out really fast. You got to go back and forth really fast because you only do 1 quart per scoop. But if you got a 5-gallon bucket, you don't have to make as many trips because you have more volume per scoop, more volume per trip. So like when the heart beats, every beat is like 1 scoop of water. So if you're dehydrated with a stiff ventricle that doesn't fill, the more stiff the ventricle is, less it fills, the faster it has to beat. And so a dehydrated heart will beat faster, especially when she's exercised. So heart rate went up to 100 beats a minute in a very short period of time. And then the blood pressure went up too, because the body said, okay, we're under stress, it constricts, and so on. So dehydration in a setting with people with high blood pressure can be bad, especially if they have a stiff heart. And Camille just said that the stiff heart is common hypertension. So for those of you out there, you have high blood pressure, your doctor may be prescribing diuretics. The diuretics may control the blood pressure. Her pressure was okay. But when she exercised, the heart rate went up, blood pressure went up, so it really wasn't doing her any good. Plus it was working against the kidney function. So even though the blood pressure number looks good, other things are wrong. So I just want to really emphasize that to the audience, and that's why, making these adjustment medications, not just looking at one number, but it's looking at the whole group of things. Do you have other labs?
Yes, sir.
The rest of the labs. So what are some of the other findings we saw on the labs?
We have a marker we follow, it's called TMAO, which is associated to vascular, is a pro-inflammatory. It's a postbiotic associated with animal product intake. Normal range of that's a 6.2. Hers was a 19.6. So we definitely know there was lots of vascular issue going on, inflammation-wise, which could also contribute to, the stiffening of our arteries and stuff like that. So that's the thought process there, was to look at it in the sense of, if we have to kind of help her, what could we do? One thing definitely was reduce some of the inflammation and try to get the arteries a little bit more relaxed. So the plan of care originally was to try to transition her into a nutritional detox program and get her into sauna therapy. Sauna therapy, like we mentioned in one of the other programs, is to help relax the artery, increase nitric oxide production within the arteries to improve circulation, which we thought at the time too, by reducing the water component, the diuretics, we can also help perfuse the kidney better. That's the goal.
So I mean, and you mentioned SDMA, and again, excuse the jargon, and just kind of back up for the general public. We do a number of different tests. We do ultrasounds, we do stress tests, we do blood tests and other things. And we're looking at the body in different ways. So when we do blood tests, we're trying to look at biochemical things. Now, no one test is perfect, so I wanted to emphasize that. So that's why we put a lot of things together. And I notice when we're discussing multiple things. We're trying to put all this together to get a big picture. One test is abnormal, like blood pressure may be abnormal, but we can't just look at that and only focus on that. We have to look at other things. So these blood tests and blood tests in general try to give us some insight as to what's happening at the tissue and cellular level. So it gives us some idea of the biochemistry. Just because the test is normal doesn't mean nothing's going on. It's just that test didn't catch it in that patient. So the SDMA, ADMA, SDMA is more for kidney vascular injury. ADMA is more diffuse vascular injury, but both were abnormal. So when the SDMA is high, that means there's some abnormality inside the vasculature of the kidney. So that's a sign of intrarenal, what was called true kidney disease. Kidney is mostly a vascular structure. ADMA is more atherosclerosis throughout the body, coronary arteries, brain, periphery. So that was elevated. So even though she didn't report a history of high cholesterol or known diabetes, etc., we found out that she apparently has had some problems with her vasculature, both in the kidneys and in the periphery. And so there's some disease there. So we're going to have to monitor this and look out for healing. From an integrative health approach, you have to look at the patient in totality. We don't have someone come in and say, oh, you have heart failure, take this medication. Oh, you have high blood pressure, take that medication. We try to take a comprehensive look at the patient, understand what's going on biochemically. We know that the food helps systemically, but we want to look at these things and follow them to make sure what we're doing is working. So we mentioned she was overweight, so would you recommend a keto or carnivore diet for her?
Oh, no.
Why would that be a problem?
Because there's some research out there suggesting that, animal protein is definitely pro-inflammatory.
Yep.
And then it can also increase your TMAO level even further, which, we always read that animal protein could be more inflammatory, but it may be more along the line of the postbiotic that's being produced, the TMAO. So the more, keto diet we eat, the higher level of the TMAO, the more stress we're actually going to put on the vasculature as well as the renal vasculature. So
I mean, she's coming in acute distress. A carnivore diet or a keto diet would probably, put her in kidney failure in a pretty short period of time.
Absolutely.
If it doesn't, stroke her out first. Any thoughts, Camille?
I definitely agree. We see I think all of us see a lot in the clinic, people who are more of a progressed renal disease and they struggle to change to a plant-based diet, their renal function is just declines over time. Even though they see a nephrologist, maybe they're put on the right renal drugs, but those medicines won't prevent the progression. It might slow it. The only way to really save your kidneys is to stop eating the foods that are causing the kidney disease in the first place.
Mm-hmm.
So essentially what we want to do now is share with you what we did. We started on a nutritional detox regimen, and then she start sauna therapy right
She
away?
did. She started sauna. She was there, had several sessions in sauna as well. Overall, she felt great. Every time I spoke with her, her energy level was getting better. She felt better. So everything was going in the direction we were hoping for.
How soon did you make medication changes, and what changes did you make?
I think the very first visit, the number one thing was to get her off of the water pill, the diuretic. I think over time, as we saw improvement, we know that there was a lot of her commitment toward following the dietary recommendations. So right now she's only on one antihypertensive when she originally came on possibly maybe 3 different drugs that were affecting her blood pressure and trying to regulate her. So she only has one right now, which shows that she's still doing better than she originally started.
Wonderful. Let's take a look. Why don't we turn over here to our screen. Now you look here. Now even if you're not an EKG reading expert, you can see that there's something different with this compared to the other findings here. And you see these little bizarre beats right here, right there. Those are abnormal beats. We call them PVCs. There's a PVC there, and so on. So this is during the resting stage, and this is abnormal. So the question is, why is she having this? We do know that the heart rate and blood pressure went up a lot. These extra beats could be due to electrical abnormalities. They could be due to abnormal blood flow. It could be due to circulation problems, such as ischemia. We looked at her lab. She has abnormal biomarkers consistent with vascular disease, coronary, renal, and the like. Would you guess that she has magnesium deficiency?
Mm-hmm.
Why?
Because her diuretic lowers magnesium levels and other electrolytes, so that can trigger the PVCs.
Yeah. And so somebody on a diuretic, now we're going to have to look at her magnesium and some other things, but that's certainly something, and we'd probably start on the magnesium, which also magnesium deficiency can contribute to elevated blood pressure. Mm-hmm. Also, there's a mention of her having stress, I think, in her life. She's an accountant, maybe insomnia, anxiety, so low magnesium level can contribute to those things too. So something as simple as a magnesium level, it could be something that we'll look at in her and start to make recommendations in terms of supplementing. So we're going to go and look at some of these findings. Here's her weight. She came in at 238 pounds, and over a certain period of time, she went to 231. We normally see faster weight loss than this, but we made some medication changes, and you don't always see a drastic weight reduction. Now, there's some other things we can do with her, do some more time-restricted eating of the like, BMI reduction, but she is still heading in the right direction. Kidney function got significantly better. The creatinine went from 2.2 to 1.36. The higher the creatinine, the more abnormal the kidney function, so you want that creatinine to come down. GFR stands for glomerular filtration rate. That's how fast the kidney is filtering the blood or cleaning the blood. You want a higher number here. You want it at least above 60. Above 90 is even better, truly normal. Hers came from 24 to 43. And just for those of you who are not in the medical professional, if that GFR goes below 15 and stays below 15 for a sustained period of time, you would then get declared end-stage renal disease and have to go on dialysis. So she was, headed in that direction. So as we alluded to, had she gotten put on like a keto diet, a carnivore diet, which we know increases TML, worsens kidney function, we could have put in renal failure. We went down on medication. Reducing medication is one of my favorite things to do. And a lot of my colleagues are really big on medications, and I think they have their purpose, don't get me wrong. We prescribe medications every day on an as-needed basis, but I have, my way of thinking is the following. From optimal health, the foundation is optimal nutrition. So pharmaceuticals is the foundation, then nutraceuticals as needed, and pharmaceuticals a last resort. So one could be critical of the fact that we haven't gotten the blood pressure under control. So what do you have to say about that?
The thing is, I hear her speaking in the sense of where I hear her understanding what her objectives are and her goals, and to try to really fix the baseline of things, and which is definitely more along the line of what we are hoping for her to do. If anything, we've minimized her exposure to pharmacologicals as needed without putting any more stress on her body. And again, just by the fact of the renal function, increasing, it makes me feel that we're definitely going in the right direction. So there's possibly one less concern of her even having to worry about issues in the future of thinking about having to deal with anything possible on the line of having even be on dialysis or anything. So
Yep. Any thoughts, Camille?
Yeah, I think that highlights that sometimes actually reducing medication improves organ function, because high blood pressure we know is one of the main causes of heart failure or kidney failure. So sometimes the first thought is, well, if their blood pressure is uncontrolled, we got to keep adding medications and that will fix everything. But in reality, that can actually worsen things. And in this individual's case, on less medication and one that's safer for the kidneys, even though blood pressure is still high, her kidney function made a tremendous improvement, and that's going to really help her in the long run.
And I just want the audience to be clear, we're not satisfied with this blood pressure either, but I think the point that our team is emphasizing is that we're not only focused on the blood pressure number. We don't treat numbers, we treat patients in totality. And Ashley mentioned that the patient's feeling better, she's more energetic, her kidney function is better, etc. So there are multiple things that are improving, that are moving in the right direction. The blood pressure hasn't gotten there yet. So there are many other modalities that we use in her situation, and of course a tincture of time. As she stays on this lifestyle, continue with the sauna, over time the vessels will heal and blood pressure will come down. So there's no urgency to just pile up a lot of medications just so the number looks good and we feel good. A very interesting case that we had today, and hopefully you've learned a lot. I've learned a lot in our discussion, and a lot of these patients will come back and do a recap, give you a follow-up in terms of their outcome. So until next time, we look forward to seeing you, and you take care.